Good morning. I'm going to go ahead and get started just to kind of keep things rolling and on time here. I'm glad to see everybody here. Quite a good looking crowd, better than last year. That's good. So I'm Dr. Scott Antoine. I'm from Vine Healthcare. My wife was here yesterday lecturing on gluten and hormones, if you happen to catch that. And so my topic is not quite as sexy as hers. Gluten and hormones kind of tends to draw a bunch of people in, but I think you'll find it's very interesting. And you may find in your own health journey that this is the way you came to understand that you had issues with gluten. It may not have been anything with your GI system, or at least anything that you thought about at the time when you came to it. So a few things, you'll hear a lot of terms when you're here or in the general public or in the lay media concerning gluten. You'll hear about celiac disease, gluten sensitivity, maybe the word gluten intolerance. You'll also hear people talk about wheat allergy. And those really are different things. So just at the get-go to kind of let you know, we'll be here today talking about gluten sensitivity and wheat allergy. But a quick review. So wheat allergy is an allergic reaction. It's like any other allergic reaction. A reaction that you might have to taking penicillin, or a seasonal allergy is sort of a minor allergic reaction. And so what happens is when you take a food or a substance in your body makes a protein called IgE to that, and then when you're re-exposed to that same substance or a similar substance, then you have a reaction. And most of us know when you have a common allergic reaction, you may have an itchy rash, your eyes may water, in worst cases you may have nausea and vomiting, dizziness from a drop in blood pressure, and then nothing? There, I'll just stand still. You can't gesture up here, it doesn't work. So in severe allergies, people will get swelling to their throat and lips, difficulty breathing, and they can actually be fatal. I have not in my career as an emergency physician over 23 years ever seen anyone come in dying of a wheat allergy. I've seen it with peanuts, certain medications, but not really with wheat. But these things potentially could happen. So there are no genetic markers for allergies, but we can do IgE allergy testing from people's blood. It's something that we do in our practice. In addition to testing people for celiac and diagnosing them with gluten sensitivity, we also test for IgE food allergies. Many times people have no idea that they're allergic to a particular food. Celiac disease is a bit different. It is not an allergy, it's an autoimmune condition. And when people with celiac disease take in gluten-containing products, wheat, they will have a reaction, typically sloughing of the small intestine, although as we'll see in this talk, the aim of this talk is talking about non-GI effects of gluten. So symptoms certainly outside of the intestine can occur. There's a genetic predisposition. We know that probably 99% or greater of patients with this will have one of the two genetic types, HLA-DQ2 or HLA-DQ8. So if you don't have those, it's very rare to have true celiac disease. You can also do an intestinal biopsy, or there's some other antibody testing that you can do with blood work that's highly suggestive of it. This is a pearl. This last thing is a pearl. Question? Sorry. Sorry. Right. Correct. So the question or the comment was sometimes you have to do several biopsies because the disease may be patchy. That is true. It can occur in different areas. It can look like different things in the intestine. And also if someone has been on a gluten-restricted diet, you can have a negative biopsy in the presence of active celiac disease. This last sentence on this slide is sort of a pearl. When I went through medical school, they give you pearls, and they are little things that you keep in your jewelry box polished up at home just to remember when you're practicing medicine that you pull out later at 4 in the morning and something clicks. And this is a pearl. Autoimmunity begets autoimmunity. So people that have celiac disease often have other autoimmune conditions, type 1 diabetes, lupus, scleroderma, several other autoimmune diseases. We typically see them traveling together. Also, Hashimoto's thyroiditis is very common in people with gluten issues. So what about gluten sensitivity? So it has no genetic markers. It's not an allergy, as best we know. And there are no real consistent blood tests or biopsy findings. Occasionally, there are certain antibody tests that are similar to celiac tests that will be positive, but not always. And it's really a diagnosis of exclusion, meaning if you have someone come in who says, you know, I've noticed when I eat gluten, I don't feel very good, or I have joint pain, or headache, or etc. I can't think correctly. But you do testing and you don't find celiac disease and you don't find a true wheat allergy, it's like... Am I back? It's likely this person has gluten sensitivity. So people referred to it for a while as gluten intolerance, and then ultimately now the most common way you'll see it in the medical literature, and it is in the medical literature, is non-celiac gluten sensitivity. So ingestion of gluten in these folks causes a lot of different things, and it's really hard to find, as we'll talk about in a minute. It's estimated that at least 6 to 9% of people have a gluten sensitivity. And what I will tell you, and I will tell you later and show you, is that gluten is a toxin for everyone. It just doesn't always manifest in signs and symptoms that you may recognize at the time. This last sentence, some consider this a controversial topic. There was an article last week in, it was either the Huffington Post or Salon, and the title of the article was, "Unless you have celiac, gluten sensitivity is all in your head." Very poorly informed article, which I wrote a rebuttal comment to using quite a bit of medical literature to explain to these people that this is in the medical literature now and it's being treated at many areas. Now this is not something that we'd specifically talk about, but sort of a breakdown of what I just talked about: celiac disease, non-celiac gluten sensitivity, and wheat allergy. The only reason I posted this is, if you take a look at the tagline down the bottom, the source, UCLA Division of Gastroenterology apparently thinks the gluten sensitivity is real. Additionally, and a little bit later, we'll go over some research from Dr. Alessio Fasano from Harvard, who's actually the chief of pediatric gastroenterology, who's written extensively on gluten sensitivity. So our topic today, that's sort of a little bit of an overview of kind of where we are, the landscape. So our topic today, so celiac disease and also non-celiac gluten sensitivity can produce signs and symptoms that are not related to the GI tract at all, or at least not symptoms that you would feel related to the GI tract, even though that's primarily where the damage is occurring. The cause can be direct. In other words, there are some things that celiac disease, for example, causes. We're not really sure why. There's certain skin rashes. Or it can be secondary. We see quite a few patients that have inability to absorb certain vitamins, nutrients, and protein just due to the extent of their disease, and that will cause other symptoms, especially neurologic symptoms. Recognition is really important for a few reasons: for diagnosis and treatment, but also for healing. If you don't think about it, another maxim in medicine is, if you don't think about it, you can't treat it and you can't ever help the patient. So this is our common presentation that we saw quite commonly in the past with celiac disease. Celiac disease, if you would see GI symptoms, the children would come in looking like this first child, and they would have failure to thrive, meaning can't gain weight, poor protein, very thin, distended abdomen, kind of looks like protein calorie malnutrition that you would see on the news perhaps from a foreign country. We were seeing this a lot. At its height, children would die. The average life expectancy was 3 years old, and it took people a long time to figure it out. There was ultimately a Dutch physiologist who figured this out, physician who figured this out, and put these children on banana diets. They were called banana babies, and the kids got better, and then they would restart a typical diet and the children would get worse, and it took a long time to figure out. An interesting tidbit is that they actually figured out most of what we know on celiac disease due to the Second World War. We know that people of Northern European descent have a much higher rate of celiac disease genetically. And during World War II, when grains, particularly wheat, was very scarce, people were not eating wheat, and there was a decrease in active disease, this mysterious illness that people would get with bleeding and GI symptoms and weight loss. And then after the Second World War, when things became more plentiful again, we saw the disease resurgence, and that's really where the headway of work we started doing on celiac disease in the medical community really made headway. So this, when you see these children, you'd expect the diagnosis within 6 to 24 months. And if you treat children and miss this diagnosis within 24 months, that's not a good thing. So pretty much everyone knows now to look for celiac disease as a cause of failure to thrive. How to get rid of that? One moment. Okay. So what about non-gastrointestinal symptoms? What do we see with celiac disease and gluten sensitivity, and why? The problem is that these things, in the absence of GI symptoms, they can take years to find, and people will get multiple other diagnoses. They'll be told they have chronic fatigue syndrome, fibromyalgia, or worse. I can tell you at our integrative practice, 90% probably or more of my patients come to us with disease or symptoms people haven't been able to figure out. They've seen a lot of different people, and the sad part is when they start talking, commonly they'll say, people told me I'm crazy, or I need to see a psychiatrist. It's all in my head. It doesn't make sense. All the tests are negative. And it's very simple, and it really looks like magic when you take these people and put them on an elimination diet, eliminating the most common allergens, wheat, dairy, corn, soy, nightshade vegetables, and a lot of them get better with that alone. Then once we replace nutrients, up their protein stores, it just looks like magic. And people who have been sick for years, my wife had a patient, she's a physician as well, here, had a patient who had had migraine headaches for 10 years, been to the Mayo Clinic, been everywhere, had Botox injections, multiple migraine therapeutics, sumatriptan, several medications, could not get better. Laid in bed every day for years, said, I'm not a wife, I'm not a mother, I can't be with my family. Very simple interventions, nothing crazy. The lady got better. Now has a headache once a month, takes ibuprofen, it goes away. So it really is, if you recognize these things, you can really make a dramatic difference. This is a statement. I mentioned Dr. Fasano earlier. So he's the Chief Division of Pediatric Gastroenterology and Nutrition, and also the Director at the Center for Celiac Research at Mass General, which is the hospital affiliated with Harvard. And so what's interesting is what we're now seeing is far more patients presenting with non-gastrointestinal complaints with diagnosis of celiac disease, sometimes not becoming symptomatic until adulthood, even as old as 70 years. We're sometimes seeing people, they've been eating and been fine all their life, and something suddenly changes. We'll talk a little bit later about why that might happen, because I'm sort of a why guy, trying to figure out why. Some of this, I always kind of want to know why. There has to be something underlying that's making this happen for it to make sense. The problem is, a lot of times these days in medicine, to not be on a soapbox, but people kind of feel like if they don't know why something happens, then it may not be real. And so we kind of push people away with that, and it's unfortunate. It's a great article down the bottom from the New England Journal of Medicine, actually, from Dr. Fasano on how to handle a clinical chameleon, celiac disease, so unusual presentations of celiac disease, and we'll talk a little bit about those. So even celiac disease itself, which we should know more about, right? We have a genetic test which will predict your susceptibility. We have blood tests looking for certain antibodies. Still, the average delay in diagnosis is 6 to 7 years if people don't present as children with failure to thrive. So a little bit about the non-GI symptoms. What are they? So first we'll talk about the skin. This is what's called pathognomonic. When you see this, this supports a diagnosis of celiac disease. This is dermatitis herpetiformis. So dermatitis, irritation of the skin. Herpetiformis looks like herpes, looks like shingles, if anyone's ever had shingles, looks kind of like the sexually transmitted type of herpes, but it's typically somewhere on the trunk or around the mouth. Another picture, dermatitis herpetiformis. I'll give you another pearl. If you see people who eat things, and when they eat things, they get a rash around their mouth, it's got to be something. It's either an intolerance, a sensitivity, celiac disease, or it could be an IgE allergy. And we see this a lot. You'll see small children eat strawberries, suddenly they have a rash around their mouth. Or people will go out for Chinese food, soy, gluten, have a rash around their mouth. Another, this is a trunk, the person's sort of laying sideways, another presentation of dermatitis herpetiformis. So it's seen in 15 to 20% of patients with celiac. Question? Yeah. That's a good question. The blisters in the last picture are almost indistinguishable. What I think you're seeing in this, and of course we're further away, so there is some, let me see, about right down here, you can see some scratched lesions and crusting. So sometimes when things get unroofed, they'll do this. And also, see this big sort of North America or South America looking patch here? This is a confluence. So sometimes when you get something like this, you'll get confluence, or you'll get a secondary immune process to it. It's called an id response, and you'll see something that looks like this. Good question. So it can be confirmed by skin biopsy. The majority of these patients, and this is interesting, have no GI symptoms at all. They present with this rash, no GI symptoms. And to be honest, before I started doing integrative medicine, if I had seen this in the ER, I would say poison ivy, something, take a steroid, follow up, and see what happens. It's also called celiac disease of the skin. Some people in the older distinction would say that's you either have celiac disease of the skin or celiac disease of the gut. But we know they're the same thing. And if you do a skin biopsy, a small intestinal biopsy, even if they don't have symptoms, you'll see damage in patients with this. Eczema, seen in 5% of celiac patients, way down the bottom, seen in 40% of gluten-sensitive patients. So eczema is a dry, kind of itchy skin. Most people either have it or know someone with it. It's thought to be immune-related. So we know that this will improve a lot of times with a gluten-free diet, even if patients don't have diagnosed celiac. Dairy, nuts, and soy are also implicated. I'm going to throw another pearl out, another pearl. If someone has eczema, the first two things to do are stop gluten and dairy. Also, when you see small children, recurrent ear infections, before they get taken to the ENT for tubes, stop dairy. I've seen it. It's remarkable how much that will be effective in preventing these things from occurring. So some neurologic signs and symptoms. Some of these can be kind of scary. They can be general. They can be even devastating. Ataxia. So ataxia, picture someone that's drunk at a bar trying to walk out. Kind of staggering, wide-based gait. It's seen in a lot of other neurologic disorders. Can be seen in stroke, especially to the back of the brain. But there's celiac ataxia. It's its own diagnostic criteria. It may be also from nutrient or vitamin depletion. So you can see, here's some common, gosh, there we are, I'm back. Satellite, low-flying satellite. This must be Comcast. Is it Comcast? Tell me the truth. I saw a joke yesterday. It said that if you want to curb the drug problem in America, just make all drugs legal, but people have to get them by calling Comcast customer service. It's just a joke. If anyone works for Comcast, I'm sorry. So some common things. See? They heard me. Some common vitamin deficiencies that you will see. Notice these are almost all B vitamins. And you will see some of these things with B vitamins. So once again, people with pernicious anemia, or you'll see these with PPIs, drugs like Nexium, things like that. You'll see drug-induced nutrient depletions. A whole other talk I give on drug-induced nutrient depletions, but can be seen with metformin for people that have issues with non-insulin-dependent diabetes, birth control pills, statins that people might take for cholesterol. But they're made worse by drugs like Prilosec and Protonix. There are clearly a group of people that need those medications. It's a small group, I can tell you. If you look at the physician's drug reference, the FDA will tell you you should never be on them longer than 6 to 8 weeks, unless you've had an active bleeding ulcer or you have Barrett's esophagitis, which is a precancerous lesion. People are on them a long period of time. But I'll tell you also that commonly it's not an issue of too much stomach acid, it's an issue of too much food, the wrong types of food, or a problem with the upper muscle at the top of your stomach that allows acid to shoot up. So neuropathy, very common, up to 20% of patients with gluten sensitivity. Numbness in the fingers and toes, tingling. We see it in certain biotoxin illnesses too that we treat in our office. Patients with chronic Lyme or with mold illness will have neuropathy as well, kind of baffle people. They've had EMGs and certain other studies, and then you will find it. So this is probably a direct toxicity to the particular substance. Headache, especially migraine headaches. My third pearl of the day, throw that out there. Migraine headaches, hormonal or food allergy or sensitivity are my top two. You can cross a lot of migraines off the list if you take care of those two things, eliminate those two things. 35% of patients with gluten sensitivity present with migraine. Brain fog, the old brain fog. So losing concentration, memory, where did I put my keys? So we're told a lot of things about aging. We're told that we should expect, I'm going to use the handheld, I think. We're going to try that. Better? Better? Sorry. I feel like Tom Jones up here with this thing. I told my kids I would do the Carlton up here, but hold on, I'm going to turn Wi-Fi off. Here we go. This is an audio-visual nightmare. No, it's okay. It's all right. So brain fog, we're told a lot of things, as I was saying, about aging. We're told that you're supposed to expect to have decreased functional capacity, that you're supposed to be forgetful, you're supposed to have aches and pains, and that's actually not the truth. What I tell our patients at our practice is our goal for them is to live a healthy life and die at the age of 95 spearfishing in the Bahamas, right? That's what people want to do. It's a shame these days that we're told that when we're 50 or 60, when you have your grandchildren, you know, oh, look, it's difficulty getting up off the ground after we play with them. Things really weren't supposed to be that way. Now, part of it's up to us, exercise, eating anti-inflammatory foods, but part of it's identifying those things and getting rid of them. So typically the brain fog is one of the first things that will improve. And so it's a major thing that is a good thing to tell patients, that when we get this under control and we remove these things, it's one of the first things that will get better. So also reported in celiac patients, dementia, seizures. So there's a reason why this happens. Gluten, and we'll talk a little bit later about gluteomorphins, actually brain chemicals that cause excitotoxicity in your brain, cause you to... Problem? Okay, sure. So there are certain chemicals produced by the digestion of gluten which can act on the neurotransmitters, your brain communication chemicals.
Starting at 12:05 on our demo stage. Our demo stage is located all the way in the back. She will be presenting on gluten-free whole grains on our demo stage. Don't miss this presentation from Melissa Hayden starting at 12:05. Gluten-free whole grains on our demo stage.
This is just like speech class in 9th grade. Starting to sweat. All right, just give me a minute. I got to picture you all in your underwear. We're okay. We're all right. Okay. So in your brain, you have neurotransmitters, which allow you to think and feel and act and remember. And some of those are excitatory, right? You have to be able to be joyful and excited and those types of things. And so when run amok, when things ramp up, you can see excitotoxicity, where people actually get toxic. That's probably where some of this comes from. Emotions and mood. Irritability. Irritability. So if you see a child who's having difficulty maintaining weight or protein and they are irritable, celiac disease has to be at the top of the list. At the top of the list, especially in kids. Depression. 8 to 30% of patients with celiac disease, at least 22% of patients with gluten sensitivity. Once again, this can be from neurotransmitters, those brain chemicals. 80 to 90% of them are made in your gut. 80 to 90% of your immune system is in your gut, because that's how a lot of things, foreign things, come in contact with you. It could also be from nutrient depletion. So B vitamins and magnesium, several other nutrients can be affected if your gut's on fire, and then not allow you to make proper brain chemistry or not allow you to conduct the signal the appropriate way. And so we see a lot of patients who will come to us on medications for depression or anxiety. And what I'll tell them uniformly is, you may need to be on this for the rest of your life, but let's see if you don't. And so some of these patients will have issues with B vitamins, with magnesium, other things that are simple to replace, are cheap to replace, and you can ultimately titrate them off those medications, which in the long run helps them feel better. So very few people are born with a Prozac deficiency, but some people have difficulty with B vitamin metabolism. And so if you give them extra, you can sometimes help. Some other symptoms. Fatigue, including fatigue so bad that it meets the diagnosis of chronic fatigue syndrome. We see it in celiac disease and up to 33% of gluten-sensitive patients. And this is the real problem. This is where you get into. People just can't feel better. And to be honest, mainstream medicine has very little to offer for patients with fatigue. Joint pain. see it in celiac patients. It's probably immune mediated, and it's seen in a lot of other autoimmune conditions, obviously rheumatoid arthritis and all of those things. And it's seen in about 11% of patients with gluten sensitivity. So this can range also from mild disease to really significant impairment. Iron deficiency anemia. You will see patients, the area of the small intestine that's damaged most often with celiac disease is the same spot where you absorb all of your iron. So you'll see patients who are anemic, and it may not be profound. It may be an anemia of 10 grams of hemoglobin, normal being 12, maybe 9, and you give them iron and they just can't absorb it. They may do okay with IV iron, but oral iron just cannot absorb it well because that area of their intestine is affected. Could also be from bleeding, which certainly people can have with any intestinal disorder. And we see it in about 20% of gluten-sensitive patients. Dental enamel hyperplasia of the permanent teeth. So these people will get some funky teeth changes. I'll show you a picture in a minute. It's seen mainly in celiac disease, but this is something now that the dentists are becoming very attuned to, because the first thing, if you were to see this, would be you would assume that either the mother took some tetracycline while she was pregnant, or there was a maternal illness, a childhood illness that caused the staining of the permanent teeth. But this is an example of dental enamel hyperplasia, celiac disease until proven otherwise. Recurrent canker sores, very common. You'll also see this in patients who drink a lot of soda. They can't connect the dots. They have canker sores every week. If you stop soda, it's phosphoric acid. A lot of times these things will go away. It's one of the things that went away when I cleaned up my diet at the insistence of my wife as we were getting into this field. Got immediately better, immediately went away. Dry mouth, recurrent rash around the mouth, remember I mentioned. Anal itching, also another big clue. You'll see it especially in kids. They are always with the hand in the pants, and it's very common with food allergy and sensitivity of all types. And then glossitis, a smooth, coated, shiny tongue. And so this may be primary due to the intolerance itself, but more commonly we see it with B vitamin deficiency, especially vitamin B2, riboflavin. An absorption issue. Riboflavin deficiency also causes migraine headaches. Other things, hepatitis, delayed puberty, short stature. Sounds hormonal, right? Osteopenia and osteoporosis, which are often nutritional, impaired calcium and vitamin D absorption. I can tell you almost all autoimmune patients also have very low vitamin D levels. If you look at the area of the world where we see highest incidence of multiple sclerosis, it's Northern Europe and then the South Pole, but not a whole lot in the equator where people have statistically higher vitamin D because they're in the sun all the time. So you'll see it, especially in Indiana in the winter. Almost every patient I test is low on vitamin D, and we supplement, and can have a significant anti-cancer effect, helps autoimmune disease, controls blood pressure, a lot of good things. Cancer, you will see lymphoma increased incidence with people that have really bad celiac disease. Infertility, there are at least 3 suggestive studies. One of the biggest studies, I think was from UCLA, showed a 4 times higher miscarriage rate in patients who have celiac disease. And that certainly makes sense. These folks are stressed, their cortisol is up. It requires the same precursors to make cortisol that it does to make sex hormones, and your body will make cortisol before it makes any of your sex hormones. So same reason why a marathon runner in high school doesn't have a period, a female marathon runner in high school, right? They are underweight, they don't have a lot of cholesterol intake, and they're constantly stressing their body. So you'll remember that if anybody was at my wife's talk yesterday. So why? Why does this occur? Why does any of this occur? So we used to think that celiac disease, once we found the genetic, which was huge, but once we found the genetic link, we used to think that all you needed for celiac was the genes, your HLA-DQ8 or DQ2, and some other genes that aren't yet identified. About 60% of the genetic risk is other unidentified genes. We used to think you just needed the genes and then number 2, the gluten exposure. What we've now found, lo and behold, is that it also has something to do with how permeable or how leaky your gut is, the old leaky gut. So normally, your intestine, this is super duper magnified, if you hadn't guessed. Normally your food kind of goes in the lumen of your gut here, and then your food goes through these little microvilli and into the cells, and then what you need is put into your bloodstream and sent all over your body to do good things. There are little tight junctions here in between these cells so that nothing can get between the cells. And you also need carriers to take almost everything into your cell. You need some type of carrier, whether it's sugar or protein, fat, anything. It needs a carrier to get in. The one exception, high fructose corn syrup. It's the only chemical we know of that goes directly into the cell with no carrier. And that's why it's such an issue. If you have impaired intestinal permeability, what happens is these tight junctions break down, food particles, foreign things, bacteria, viruses, get immediately into your bloodstream and then cause inflammation, autoimmunity, all sorts of stuff. There's blood-brain barrier issues. So all this chaos ensues because your body freaks out. There's invaders in the blood. How'd they get there? What are they? I know they're not me. I got to kill them. And you make a lot of antibodies. Another quote from my friend Dr. Fasano, the gut is not Las Vegas. What happens in the gut does not stay in the gut. And that's where this whole thing revolves. There's this protein called zonulin. This was just found in the year 2000. It's a fantastic discovery, but it is a gatekeeper. It opens up those tight junctions and lets people in. It's very elevated in people with celiac disease. And it's also elevated, we found, in insulin-dependent diabetics and several other autoimmune diseases. So there seems to be this common thread. You need a genetic predisposition, you need something to pull the trigger, and then your gut needs to be leaky, and then you have this chaos. Genes which make zonulin are on chromosome 16. Zonulin is also associated with the following diseases: Crohn's, rheumatoid, lupus, type 1 diabetes, brain cancer, breast, lung. So the folks that say, well, gluten's a toxin and I eat gluten and I feel fine, maybe this stuff's coming. Autism has also been linked to leaky gut, and some kids improve with a gluten and casein or dairy-free diet. What's also interesting is on chromosome 16, there are some other genes which we now think are related to the incidence of autism. Fascinating stuff. So gluten itself is unable to be completely broken down. It just can't. It's not something your body can easily break down. The protein is broken into segments which look like broken strings of pearls. And this is some three interesting studies. These are the citations here. But these particular regions of gluten, and I can't see the colors well from here, so I will tell you. This gliadin molecule broken down from gluten, the red area right down here is cytotoxic. So when cells are exposed to that in your body, it's cytotoxic, kills the cells, certain cells. We don't know what cells yet, but it's cytotoxic in the test tube. This light green area here is immunomodulatory, so it makes your immune system kick up. The gut permeability issue seems to be this blue strand right here, seems to increase gut permeability. And then finally the dark green causes inflammatory chemical release in patients with celiac. So a lot of what happens is due to inflammation. Now gluten, what it does is that it increases zonulin in celiac patients, and it brings zonulin right to the door, says open the door, and it goes straight through into your bloodstream. Remember, we now have an undigested foreign protein in your bloodstream. Your body's doing what it needs to do, which is make an antibody to that and try and kill it. So gluten, as I said, for that reason alone, because that happens in everybody, it's a toxin for everybody, but only some people develop symptoms. Remember what I said, though. Are you developing symptoms or signs you have no idea about yet? Why is autism 1 in 68 boys now? Why? Why is breast cancer huge? Why does everyone have an autoimmune disease? Why is everyone on Nexium or Protonics? Right? We have all of these diseases that are becoming much more prevalent. It's interesting, I talked probably 6 months ago to a group of physicians. Not the warmest reception I ever had, but as I was talking in this one particular portion of my talk, I said, you know, autism's now 1 in 68 boys. How can we say as physicians there's not a toxin, there's not an environmental influence on this? And someone said, well, you know, that's just because we used to call those kids mentally retarded. And I said, wait a minute, it's gone up 163% since 2009. And I don't know, if anybody knows, has the definition of autism changed since 2009? I don't think so. So there's something going on. Gluteomorphins. This is an interesting field of study. Gluteomorphins, they're also caseomorphins with dairy products, but they are morphine-like chemicals in your brain which are stimulated when you eat gluten. So, are we addicted? When you hear people say, I just can't get off gluten, I have to have bread, I just can't stop eating cheese, it may be somewhat related to this. There was an interesting study recently also which showed that kids with autism are not able to break down caseomorphins in their brain. So fascinating that the buildup of those caseomorphins may possibly cause nerve damage leading to autism. So, right, we've all seen this. So this was given to me by a church member, right? Let's not get sensitive. I love Jesus too, I do. But this is what you'll hear, right? This is what you hear from people. What? This never happened in the past. Are we all too sensitive? We're just a bunch of babies now. Everybody's got a disease and a gluten sensitivity, and what's the deal? So it's true. Things are different than they were back then. Let's look at why. So are they different? Yes, they're different. So the same way I would rebut the yes, there is more autism because the CDC has statistics, I would say this is a great view here between 1970 and now, and we certainly have known about celiac since the 50s at the earliest. We've seen a quadrupling of patients with celiac disease. It's not just more diagnosis. We've had the same diagnostic tools now that we had then. We're seeing more patients who are tested test positive. So there's definitely an increase. It's true. This may be part of the reason why. So on the left is what you were taught wheat looked like when you're in school, only it doesn't look like that anymore. It typically looks like the one on the right. So the wheat on the left is the Jesus wheat. So this is the wheat that was in the unleavened bread at the Passover Last Supper. Then in the Middle Ages, they came up with this middle strain. You can see 50,000 genes in and of itself. We've now engineered these and combined them. And the result, you get a much higher protein content. In the 1950s, the gentleman that did this, the scientist that did this, got the Nobel Prize, staved off starvation in many African countries. But this may be part of the story. We're giving your body a lot more genes, a lot more chromosomes to deal with. What else? Food toxins, right? Processed foods, sugars, increased sugar consumption. Other toxins, so we're seeing industrial chemicals and pesticides, medications, heavy metals, maybe EMF, for all this wireless stuff we have going on here, but electromagnetic frequencies, stress. Stress is definitely an environmental issue, and I'll tell you, we see patients in our practice, metabolic and nutritional practice, where we'll take them through everything, we'll do genetic testing, we'll fix their diet, we'll supplement them, we'll treat them for heavy metals, we'll balance their hormones, and you can't get them that final mile, and it ends up being maybe you don't need to work 70 hours a week. And I don't say that lightly, because it's difficult to find a good job and support your family these days, so I never say that lightly, but sometimes I get to that point and I just ask the question and say, do you think your job could have something to do with this, or your relationship, or something else? So at our practice, we always try and tackle things from multiple areas, right? Because stress alone makes people sick. I work in the emergency department 2 days a week, and I can tell you I work every Monday, which is kind of a curse and a blessing, but every Monday morning at 9 a.m. is the highest incidence statistically of heart attack in the United States. So you're chilling, Bahama breeze on the weekend, and you got your sandals on, and then Monday morning, 9 o'clock, the alarm clock goes off, you get up, you fight traffic, you get in, and your boss walks through the door and you develop chest pain. So we do see this. It's sort of, we joked about it for a while, and there's now some data behind it that it's actually true. What else? Our microbiome has changed. So your microbiome, your intestinal environment, that little terrarium that you've got brewing in your colon. So your body, as you sit here, has 10 trillion cells. That's what you are, you're 10 trillion cells. I have news, you have 100 trillion bacteria in your intestine. They outnumber you 10 to 1. You are mostly bacteria, sitting in that chair, mostly bacteria. We know that a single course of antibiotics can alter your bacteria in your intestine. If you do nothing, it will take up to a year to start restoring some of the other bacteria, and they actually never will get back to normal until you eat fermented foods, probiotics, something to get the balance back to normal. So that balance is right, and we're now seeing articles on probiotic treatment of depression. Who would have thought, right? Your gut may have something to do with depression. We also know there's experimental studies with agouti mice, these little mice that are bred to be obese. And they've now taken stool transplants from those mice, put them in healthy mice, thin mice, I should say, and those thin mice gain weight. That's fascinating, that your microbiome may have something to do with your ability to gain or lose weight. It's absolutely fascinating. So try and get people healthy on multiple levels, but these are some things that have changed. So how do you fix it? What do you do? Well, there is hope. And this is sort of a general approach. It's an approach that we use in our practice to patients, and it's the 6R approach. Some people say 4 or 5. We go with 6 R's. So the first thing is removing the toxins. So if people are in a mold-filled house, get out of the house. I also don't say that lightly. That's a hard news to deliver to when people have issues with mold. Mold is a terrible thing, also something that the mainstream medical community is still saying doesn't exist. The deal with mold is this, right? You take 10 people and you sit them in a room with a ton of mold. 8 of them walk out and they're fine. 2 of them don't. Why? HLA haplotype, same genetic thing that you see with celiac. People with mold have the same issue, and they just can't get rid of the toxin, and they get super sick in very nonspecific ways. Headache, visual blurriness, sensitive to sound, all sorts of stuff. And so removing the toxins is a big deal. Foods, processed foods, environmental toxins, abnormal flora from the gut. So a lot of our patients that come in that are sick, especially with food allergies and sensitivities, have abnormal gut flora. Either they've selected that out by taking antibiotics over the years, and I'm not an anti-drug guy. I work in the ER, I give antibiotics all the time. I use some of the most expensive medicines in the world when we need to, but at the same time we just have to remember in the back of our brain what those do. Replace nutrients and vitamins, so there are a lot of things that you can't get enough of. If you live in Indiana in the winter, you do not get enough vitamin D. If you could be sunbathing or in the polar ice club, diving in the river, you're not going to get enough vitamin D just because of the way the earth is tilted and how much sunlight there is and the shortness of the day, and et cetera, et cetera. So, and it's very hard to get vitamin D with foods. So it's best to take a good vitamin D3 supplement with a fatty meal. Same thing with fish oil. Fish oil is anti-inflammatory. It's magnificent. It's very helpful for a million diseases, helpful in healing the gut. At the same time, you want to make sure it's a pure preparation. But fish oil, in order to get enough omega-3, you'd have to eat fish about 8 times a day, at which point your mercury meter would go off, and then you'd be seeing us for chelation to get rid of the heavy metals. So replace nutrients and vitamins as they're needed. Make sure people are getting enough protein. Everyone should be eating at least 1/2 your weight in grams of protein a day. That's a lot of protein. And 1/2 of your weight in ounces of water. Repair the lining of the gut. So repairing of the lining of the gut is important. We use glutamine powder for this, 2 grams a day. We also use We're good. I'm literally going to drop the mic when I'm done. I'll turn it off, though, so don't worry about it. It'll be all right. Okay, so repairing the lining of the gut. We also use certain botanicals for this. In our office, we have certain products we use. Black walnut will do this, slippery elm, willow bark. There are several other botanicals that are great for healing the lining of the gut. Re-inoculating with probiotics. If you're using probiotics, it's important to remember that a probiotic should have as many strains of bacteria as you can get, beneficial strains, that is. You should have at least 20 to 50 billion units. Our patients with Crohn's disease and ulcerative colitis, we push that up to between 100 and 225 billion colony-forming units. Remember this, though, if you're a fan of fermented foods, naturally fermented foods, raw sauerkraut, things like that, they will have up in the trillions of colony-forming units of beneficial bacteria. So remember that, and I'm not a fan of dairy-based probiotics. Just we see a lot of inflammation with that. Rebalance hormones, very important, getting people's cortisol down while you're dealing with the dietary stuff, dealing with the stress as well. You know, it's funny, people say, when you see someone with gluten sensitivity and they're depressed or anxious or have another intestinal ailment, and they always say, oh, that's just because they have a chronic disease. No, it's not. Because we see people with other chronic diseases, cancers or diabetes, and they don't have as high a rate of depression and anxiety as people do with GI disorders. It's just higher because that's where your brain chemistry is made. And then ultimately rotate foods. If you want to hold off on developing a food allergy, rotate your foods. Don't eat the same thing every day. I know I'm guilty. I love eggs every morning. But try and rotate your foods as best you can. Very important. I'll leave you with this last pearl. This last pearl, and it might be the best pearl. It's not even really on the topic I was talking about, but there are 3 things that cause all chronic disease and cancer, and there they are: inflammation, autoimmunity, and oxidative stress. All 3 of these processes are vital. If you couldn't boot up your immune system and cause inflammation in your body, you'd die when you got a paper cut. So they are all important. Oxidation is a chemical process your body uses when you digest foods and to make energy out of it. You also use that same process to kill certain invaders. Your body will inject high-strength oxygen into certain pathogens to kill them and make them explode. It's exciting. But all 3 of these things, if they occur in excess, will cause a problem. So if you look at what gluten does or any other toxin does to your body, increases inflammation, increases autoimmunity, and increases your oxidative stress. Smoking does the same thing. Saturated fats do the same thing. Processed foods and chemicals do all those same things. So, we hear a lot about cholesterol. I'll give you another piece of advice. Cholesterol itself is inconsequential. It's an innocent bystander. To cause disease in your vessels, cholesterol has to be oxidized. It finds an area of your vessel that's inflamed. It enters in only where the inflamed spot is, and then macrophages from your immune system come, eat it, and explode, and then make a little lump on your vessel, and now you have coronary artery disease. So the solution is, yes, taking cholesterol down if you can naturally, but it is also killing these 3 things. You stop those 3 things, you'll stop the majority of disease. We'll all die someday, but you have to do your best in the meantime, so that you can fulfill whatever mission you were put here for. So, I hope you enjoyed your tour of Wildwood, New Jersey at night, by the way. It's a fantastic place. We are at booth 325. I think we have a minute or 2 for questions. We have 10 minutes. How do you like that? Hold on, let's try something. Let me pass this to you. Good luck with it. It was shocking me.
Okay. I have been diagnosed with celiac disease. I try to follow a gluten-free diet as best I can because it makes me really sick if I eat gluten. But I am still sick. I'm still having a lot of symptoms. I've done supplements. I've done paleo. And even when I was doing paleo and I wasn't having any kind of high carbs or high sugars and was doing supplements, I'm still sick. So do you have any ideas to what the cause may be?
So the question is, you've done the paleo diet or you've eliminated gluten, you've done a lot of things, you've taken supplements, you've followed every bit of advice you can find, and you're still sick. Yeah. So that's a complex question because there's a lot of things that it could be. And so when patients come into our office, what we typically do is we sit down with them, go over their medical history, their life history really, from your prenatal portion all the way up till today, talking about what you ate, what you did, what you drank, how sick you got, what you got sick with, were your parents sick, is your family sick, are you under stress, what do you do for a living, what do you eat and drink and do, and how do you relax, all those things. Once you figure all that out, then you have to come up with a plan to test. And so there's some common things you test. How's your kidney function, how's your liver, how's your blood count. We also test for food allergies and sensitivities, try and figure that piece of the puzzle out. We test hormones in everybody, because whether it's the primary cause of the problem or it's reactive to what else is going on, people with unbalanced hormones feel pretty crummy too. We also, depending on the people's history, where they've lived, if you're in sort of the industrial belt in Michigan or Illinois, Indiana, a lot of times we'll see people with heavy metal issues or problems with volatile organic compounds that are used in manufacturing. We see those. We take a history for the types of places people have lived, looking for mold exposures. Lyme, we're seeing a lot of Lyme disease, another controversial area. Most of the times in this area of the country, if you ask people about Lyme disease, they'll say, really, it doesn't exist, and if it does, it's just a small problem. You take antibiotics for a few days. We see a lot of people with chronic issues with Lyme. Lyme itself is probably a biotoxin, similar to mold, and it sticks around. And we know that there are certain people with certain genetic types that just can't get rid of it. Put them on antibiotics, they feel good. You stop the antibiotics, they feel bad. That's not supposed to happen, right? You take the antibiotics, it's supposed to go away, but it doesn't. So those are other unusual things that we see. So it may be that there's a common thing people didn't find in you. It could also be that it's an uncommon thing that people didn't find in you. So those are some things that and then there's always we don't always figure it out. So there's always the person that you rack your brain about, and you really have a few of those people where you just can't quite figure out that last little bit. Almost everybody gets a great deal better, but not everybody gets 100% better. That's kind of the way it is. So, any other questions? Anybody? Beeler? Anybody? Sir? So the question is, I mentioned bleeding as a cause of iron deficiency anemia in patients with gluten sensitivity or celiac disease. We also see it in almost all other food allergies. Yes, you'll see bleeding, and rectal bleeding typically. It's not usual that someone would be vomiting blood, but you'd see rectal bleeding typically. It's usually not anywhere else. So when you think about your GI tract, you're really, when you swallow something, it's outside your body. So the same skin you have here continues, it's a little bit different, but continues, goes all the way out to your bottom. So you're almost like a donut. When you take something in, it's just being seen by different skin within your body, and then it goes out of you. And so just like if you put something irritating on your skin or something you're allergic to, you might get a rash that bled. Same thing on the inside. So we do see people with bleeding just from celiac, or if people have another autoimmune disease, Crohn's disease, ulcerative colitis, they'll bleed from that. And the good news is when you eliminate, usually it's the elimination stage, we put people on an elimination diet, usually that's the point where they stop bleeding, and we say, well, now we found something. If not, the food allergy and sensitivity testing sometimes helps with that too. And for the people that are resistant, there's other things you can do, the immune system, to help bleeding. Any other questions? Ma'am. Books, CDs, or YouTube presentations? I don't. We were just talking about this last night. My wife said we need to write a book. It's, right? You're always looking for the next thing for your practice when you're in business to kind of make money when you don't have to be someplace. But no, we don't. But so we're at booth 325. You can stop over there, get some more information. Also on the front page of the notes, you'll see our website. Our website has quite a bit of information, several video clips on there. And if anybody is interested at all, you can also contact our business. Sometimes we'll put talks together for groups of people. If you get a group of people together, we'll put a talk together to come and talk to people. It's just what we like to do, to talk to the community. Sir. Yeah. Right. Yeah. Right. Yeah, so the question is about the increase in chance of celiac. Whenever you have an increase in any disease incidence, the question is always, do you have a new tool to diagnose it? Is it more prevalent in the community, or are you testing more people, right? So what I would say is the increase that we've seen in celiac is of the people we're testing, more of those people are testing positive, and the disease contour has changed, whereas we're now seeing much more adult onset, and we're seeing people that have been fine their entire life, and now they get deathly ill when they eat. So it's clearly something has suddenly changed, usually in the intestinal microbiome. So I think the incidence itself is going up, but it's a good question because it's always, if you test more for things, you'll find more of it. So then you say, is it more? So when we look at percentage with celiac, were you looking at people with the same groups of symptoms that you test finding a higher percentage of true positive results? So, ma'am.
Okay, is it important to test to see if you're a celiac, or if you're just insensitive? Does it matter once you've eliminated the gluten? Should you test to see if you have celiac disease? You should,
It's simple. It's usually covered by insurance. You can do both. We do both the genetic testing as well as the antibody testing for it, because it's the first thing you can easily remove from the list that may be making you feel bad. And the problem when you start talking about Alzheimer's or other things going on, you have to be much more strict. So if you're gluten sensitive and you eat a cupcake, you may not feel very good, but you're not going to get as sick as someone who's celiac. So we know that it takes as much gluten as a grain of rice, a quarter of a grain of rice, I should say, to make someone with celiac sick if they eat it. And that's why it really changes the person's life, because you now tell them, good luck going out to eat, unless you have a certified gluten-free kitchen. And even then, you never know who's working there and how careful they're going to be. So you end up sequestered at home, not able to eat, or doing what I end up doing a lot of times, sitting, drinking a glass of water while other people eat and watch them, depending on where they decide to go. It really changes your social life. So for that instance, it's telling people how strict they need to be. You know, can you have bread made in the same toaster as regular bread, that kind of thing, for which celiac is a big change. So we test everybody.
Next question.
Yep.
Is there a way to test?
If you've been off for years, is there a way to test? So that's a really good question, because chances are if you were to put a scope down, you wouldn't have any damage to the microvilli, so that test is probably not going to be helpful. Also, if you take someone who's been off gluten for a long period of time and you test them for tissue transglutaminase antibodies, it's probably going to be negative, maybe 50%. So the test that you're left with is the genetic testing for DQ2 and DQ8. That's in every cell of your body, doesn't change from you're born till after you die even. So that's the test you want to do, the DQ8 and DQ2 testing on everybody. If you don't have that, it's extremely unlikely you have celiac. You may still have gluten sensitivity. But I've never understood, the gastroenterologists have made some statements in the recent years like, no one should ever be told that they have any problem with gluten until we test them and tell them they have celiac, and then they should stop eating gluten, as if they own the diagnosis. I don't quite get that, because if your friend called and said, I ate at Taco Bell last night and I feel awful, I'd be like, don't eat at Taco Bell anymore, right? I mean, that's like common sense, and I think gluten's very much the same. Any other questions? Ma'am? Yeah. Yep. Yep. Sure. So you test, her son tested positive. She's not my patient, so it's not a HIPAA violation. So her son tested positive for both celiac genes and still eats gluten anyway. And my son last night went to a wedding and ate a slice of birthday cake. He's not here today because he doesn't feel good. He doesn't have celiac, but he has gluten sensitivity. We've known for years, and so good for him. They learned their lesson. But will he develop celiac? That's the golden. He's tested negative for blood tests, but not for, right. So he's not making antibody to it for right now. So there's about 60% of the genes for celiac that we don't know. And so he may not have any of those. He may just have the DQ2 and DQ8. How you use the genetic testing is if you don't have DQ2 or DQ8, it's extremely unlikely you have celiac, like less than 1%. So that's usually a good indicator. Not making the antibodies is not as much, and there are other genetic factors. So he may not have any other genetic factors. If we saw someone test positive, we would say pretty much you need to avoid that. And we tell all our patients that because it's a toxin, because it doesn't help, you're kind of rolling the dice. And we know that patients with gluten sensitivity get some of these diseases as well, right? I mean, everybody gets neurodegenerative or autoimmune. And so interesting too, if you have people with antibodies to their thyroid and you take them off gluten, a lot of times the antibodies will become negative. They may still have hypothyroidism, but the antibodies will go away. That's fascinating. There's this cross-reactivity. Ma'am, one more question? No? About the hypothyroid, yeah. Yeah, your body sees your thyroid as gluten, or gluten as your thyroid. So when it starts making antibodies, it searches your whole world over, sends all the soldiers out looking for similar antigens, and it'll attack your thyroid. And that's same thing with your pancreas with insulin-dependent diabetes. Time? Sorry. Yeah. Sure. Sure. Yeah. It's a hard disease. Yeah. Right. It's a hard disease. All right, I'll tell you what, I'm going to be in the back, and then I'll be over at our booth at 325. You can stop on over and see us. We have some free samples and drawings and all sorts of neat stuff, and come and talk to us more. Thanks, everybody.